we need to hit start on the camera? Okay. You good? Okay.
If you are ready, we'll go ahead and get started. Good afternoon, everyone. And as always, thank you for being here and helping me get the messages out to Shelby County. Today I'm going to take a little bit of a different twist. I'm going to give the regular update, but I really want to focus on some key talking points about what people should expect when they're tested, what they should do if they test positive, and what they should do if they're a contact. So at the current time, we have 638 cases in Shelby County. And as of yesterday's report, we've had an increase in the number of deaths, so we're up to 7 deaths in Shelby County. We have tested 7,007 individuals in Shelby County. 90% of those individuals were negative, and 638 were positive, so that's a 9.1 positivity rate. We are still receiving significant calls to our hotline, and so to date we've received 1,925 calls. As you know, statewide the numbers are up to over 2,600, and while we have more numbers than Davidson County currently, you do have to think of Davidson County as a metro and consider the cases in Williamson, Sumner, as well as all the way up to Montgomery, just because of how big that area is currently. So there's a lot of movement back and forth there. As far as the Joint Task Force, our priorities still remain the same. That's a focus on the safer at home, stay at home compliance. Focus on case finding, which is testing, access to testing. Our contact investigations, but the reason contact investigations are important is because of the need to get people quarantined, which is what I'm going to focus on today. Predicting the surge and preparing for the surge. This morning we did share a map that has some early predictions of when we expect the surge, which would be that third week of April into the 1st of May. Our team, as well as individuals from UT, the fire department, and the city are working on refining that model and hope to have a more accurate prediction as this week moves on. We're still working to prepare for the surge, which is assuring that there is adequate overflow for hospital beds as needed, and then to make sure that there's sufficient PPE for everyone. But as our numbers continue to grow, one of the things that we have to do within public health is shift our approach and really prioritize our contact investigations on high-risk areas such as nursing homes, healthcare facilities, places where people are more densely populated, and rely more heavily on the public as well as healthcare providers to assure that individuals are isolated or quarantined. So individuals who are being tested currently still meet CDC criteria, so that means they're either been a contact to someone that is a known case, or they're exhibiting signs and symptoms of COVID. So there are many testing sites across the community. We still do not have rapid testing here locally. Hopefully we'll have that soon. But as soon as an individual goes for testing, they have to understand they have to remain isolated until that test result comes back. Now, I have personally talked to some very intelligent people who did not isolate during that time period and were positive. So it's really critical that all of us do our part. And in addition to staying apart, we have to really think about isolating and quarantining ourselves appropriately. So if you get tested, you remain in isolation until the test returns. Isolation means you stay in a separate part of the house. You don't come in and you don't go out. No one's coming in, you're not going out. The only time you will go out is to a medical appointment, and you would wear a mask. When the test results come back, if they're negative, all is well. If the test results come back and they're positive, a person has to remain isolated for a minimum of 7 days and to be fever-free and symptom-free for at least 3 days. During the time that they're isolated, again, they're not really to leave their home except for medical appointments, and that would also mean that they need to wear a face mask when they go for that appointment. And others can't come in and out of the house. Family members should stay in a different part of the house, and in some cases, family members actually move elsewhere to avoid contracting illness while the person is ill. If the person is ill enough that a family member has to care for them, then family members should really exercise significant caution by wearing a face mask, gloves, and hand washing on a regular basis. And medical care should be sought only as needed. Unfortunately, most of the care that one would receive is the care you would receive at home, unless you need to be in intensive care or a hospital bed. So trying to stay home, staying well hydrated, managing the fever, and so on is what's most important. For individuals who are contacts, a contact is defined as somebody who has had very close contact, so less than 6 feet, for 10 minutes or more. If you're a contact to somebody who tests positive for COVID, it's important that you quarantine for 14 full days. Quarantine is similar to isolation in that you stay in your house. You don't really go out except for a medical appointment if need be, and you wear a mask, and you don't have people coming in and out of your house who aren't typically there. You also, if you have family members who are more at risk, you may opt for those family members to be elsewhere and to stay elsewhere during that quarantine period. This will be our message consistently because, again, we've reached a volume of cases that we have to prioritize those that are most at risk in those high-risk settings, and going to rely on the public and healthcare providers to ensure that people are adhering to isolation and quarantine. As far as the age groups, we still have about 80% of our cases in people under 60, but we are having an increasing number in people over 60. And that's a very high-risk population, and obviously those who have chronic illness. So we want to do everything that we can to protect them. I want to end with two key things. One, business has been brought to our attention repeatedly. That's Hobby Lobby. So if anyone's checked on Hobby Lobby, they are closed. And then we're getting questions about swimming pools, and it's not recommended for swimming pools to open. I will be talking with Mayor Harris today, and we'll make a final written recommendation, but across the U.S., pools are considered non-essential, and generally people congregate in numbers of greater than 10, so it's not recommended to open them. So I'm going to end there and open for questions.
Are there any more deaths at the Carriage Court?
No. That doesn't mean that won't change, but at the moment, no.
We've seen reports that there are proposals being put in for areas that are willing to open up their locations for you to use those facilities for hospitalizations and beds. Can you speak on any of those locations or how many you're looking at and kind of what are the requirements you're considering?
So actually, through the task force, we have been looking at options for people to stay, locations for people to stay, not the hospital location. So let's separate those out. You know, having a full-scale hospital, we'll do that in partnership with the state, and that's underway. But the other thing that we had to look at is, and I'll use an example. If you recall, when we had only 4 cases, 2 of those were travelers, and so we had to make sure they had a hotel that they could stay in. And so we also have had to consider if someone's experiencing homelessness, where could they stay if they did not need to be in a hospital, and generally those will be in hotels. So there's a variety of hotels and motels that have reached out to us. There's a whole team that's working on that. Dorcas Young-Griffin, who is over our Community Services Agency, and Paul Young, that's their primary responsibility. And I don't have the full list. We have a variety of places that have offered locations. What we really need for individuals who are being isolated or quarantined is a facility that has a separate heating and air conditioning unit. Not a central heating unit, and ideally one that has like a refrigerator and a place that food could be stored, so that the person doesn't have to leave to get food, that we can deliver food to them. There have already been some incidences where people who were experiencing homelessness and the facility they were in was not able to stay open for whatever reason, and those people have already been placed in hotel rooms. I'm gonna go that way and come back. Okay.
Should read it.
Okay. Just needed to clarify a little bit. So you said you guys are looking at a facility. You guys are working with the state to find a facility that would act as a hospital
Yes.
to have extra beds.
Well, the beds would have to be brought in. So you find a facility that can serve as a hospital space in the event that it's needed, and it's better to have that planned before the surge and ready to go. And so there's a variety of facilities that the National Guard and FEMA have looked at in the past week.
So that would have the 1,000 beds. I know in another press conference they're talking about that. So that's what they're talking
Correct. The ideal would be able to hold up to 1,000 beds, but some facilities may not be able to do that, so there could ultimately be more than one facility, but the goal is to have bed capacity up to 1,000 beds if needed. And what the ideal is, and this is what's happened across the country, is you move people out of the hospital who don't need as high level of care, so that people with COVID-19 are able to be in the hospital in intensive care or the negative pressure rooms.
Dr. Householder, I know that your task force member, Dr. Jane, was talking about maybe needing 6 to 8 times as many ICU beds and 2 or 3 more times of ventilators. Do you have similar quantitative needs as well?
So, and let me tell you how the task force works, so that you know in the end we're all on the same page. We have one group that's the predictive analysis group, and that consists of David Sweat, who's our chief of epidemiology, who you've seen speak here, 2 of our epidemiologists that are doing a lot of our analytics, 1 data analyst from the fire department, and Dr. Jane, and then I weigh in as well as Dr. Randolph. So the group collectively, and Doug McGowan weighs in as well, collectively will come to that prediction. It is still in process. There's a variety of different calculators that have been used to determine when the peak will occur in different communities, and some of those calculators take in more factors than others, if that makes sense. So, you know, how much social distancing do we really have? And that makes a significant difference on the surge. What is your demographic population? Do you have more seniors? Do you have more younger population, and so on? So they're working to make sure that we're as accurate as we can be, but I would say we're not completely there yet.
Question over here.
I want to ask, let's do a hypothetical here for quarantine and isolation. Let's say you've got a family of 4, 2 parents, 2 children. One of the parents starts feeling ill, ultimately is tested for COVID-19, awaiting results. What needs to be happening inside that household? Who needs to be where? Do the children need to go stay somewhere else? How can we explain that to people so they
That's a great question. In an ideal world, and we know every household is different, that individual who's waiting for the test results should be isolated in a different room in the house and really try to avoid contact with everybody else in the house. Now, that may not be feasible depending on the size of the house, you know, how sick the person is, and so on. If people have the ability to have the children or others stay somewhere else, that's an option.
And so the other parent should be, if room is available, in another side of the house.
With the children.
Only caring for the ill person with a mask on, or if they need to be in there.
Correct.
But the other parent needs to stay quarantined for 14 days.
Once the test result comes back.
Okay.
So essentially when you get the test, you have to make an assumption that it could be positive and treat it like it's positive. So that person's isolated and you're already beginning to quarantine everybody else in the house. Once the test result comes back, then you make additional steps based on that test result. Well, that way I'm gonna come up here.
We've heard that the FedEx Forum is being considered for the surge site. Can you comment on that?
That's one of the facilities that FEMA and the state visited. Yes, sir.
Yes, so, this morning, I think there were, the count of fatalities was 5, and it's now, I think you said up to 7.
Yeah.
What could you tell us about those who've, passed away recently?
So, honestly don't have all the details on all 7 of them, because they have come in just over the last several hours. I do know amongst this group, we had somebody who was in a younger age category, under 40. Everyone else thus far, if you recall, I've said has been the 50-60 range. I know one person is probably over 80, and if not more than one, and then one person was younger.
Okay.
Did you say younger than 3 or younger than 4?
Younger than 40.
Okay, 40, okay.
And Dr. Householder too, are there any special provisions that funeral homes are being asked to comply with on handling bodies of those who died of COVID-19?
So it's a really great question. The funeral industry had released instructions to funeral directors and medical examiners some time back, and that information is available to those funeral directors as well as to the medical examiner.
Okay. And one more question on fatalities. In certain parts of the world, there have been so many fatalities that the morgue cannot accept them all. What are plans in case we reach that point in Memphis?
So one of our agreements with the West Tennessee Regional Forensic Center, which is managed through the University of Tennessee Health Science Center, is they serve as a mass casualty site. So they have some expanded capacity on their facility in the event that there's a need for expanded facilities. Part of the role of the Regional Hospital Coalition is not only to look at hospital needs, but also if those hospitals have a high number of decedents, how do we assure appropriate locations for those decedents until their disposition?
Thank you.
Dr. Householder, is there any consideration for using mobile phone data to assist in contact tracing?
So that's interesting because, you know, University of Memphis is working on an app that does allow for monitoring where people are and determining if people come in less than that 6-foot contact. That's still being worked on. There are some legal questions that people have had about that app. So at the current time, our position at the county level is to wait and see when that app's available and let the attorneys work through any concerns they might have about the legalities of the app and determine the best usage that we might have for it here in Shelby County.
Regarding the facility, the one that you're working with the state and Army Corps of Engineers on, so that would just be COVID patients?
No, typically what happens is the COVID patients are higher acuity, and they generally are in the hospital where you have ventilators as well as ICU beds and negative pressure rooms, and you have less acute patients that can be moved to the other facility. Now that doesn't mean it would always be that way, but that's the general thinking that occurs, and that's what's been happening across the U.S.
So that would be for anything,
Right.
any type of illness?
Yes, as Chief Benson said yesterday, heart attacks still happen, strokes still happen, car crashes still happen, even though we have COVID, and we have to be prepared to care for those individuals, even though we have the COVID epidemic.
So then
Go ahead.
so then the COVID patients would just be in the regular hospital?
Right, you want to try to keep them all together if you can.
Yeah.
Dr. Householder, I know we've been waiting on the data this week. Do we have a better idea of the number of people in hospital beds right now with COVID-19?
So what's happened in the morning meeting is each individual healthcare facility has been reporting out on their own data. And there's a little bit of variability because you can think of big systems like Baptist. They have facilities in DeSoto as well. And so they've been reporting out individually. It should be visible in the Hertz data probably by tomorrow morning so that it's a more comprehensive view of all systems at one time. We have been asked for that particular data, and unfortunately that's state data. It's a state database, and we've been asked not to release local data while the state may perhaps release statewide data.
We've been reporting on this obviously for weeks, and now that people are passing away, we're hearing sometimes the victims, their photos, stories about their lives. Is this the point, do you think, where it really starts to get real to the public at large, the threat that this poses? I mean, are we past the point where some folks have not realized how serious this is?
Yeah, I think may always be people who doubt the seriousness of it, and our hopes are by, one, having the press conferences, we have many elected officials speaking to this at not only the local level, but the state level and the national level, and then the personal stories, that hopefully all of that combined will compel people to understand this is a serious matter, and that we all have a part to play in making a difference. And we all need to get the message out that this is serious. I've been in practice nearly 40 years. This is probably the biggest epidemic I've ever been involved in. So this is a once in a lifetime epidemic, and I think it's important for those of us who know that to say that, so that people understand this is something very serious and that we need to take appropriate action.
Dr. Oswalter, can you comment on the infectiousness like compared to tuberculosis?
So that's a great question. I actually worked in TB for many, many years, and that's a passion of mine. Tuberculosis, generally you have to be in close contact with somebody for 4 or more hours while a person is actively infectious, so coughing, febrile, and so on. Compare that to COVID. You only had to be in contact with somebody for 10 minutes and less than 6 feet. And more data is coming out that people are infectious 2 to 3 days prior to becoming ill, and so that's when they're asymptomatic, so there's a lot of opportunity for transmission before a person really knows that they're ill. So that's why social distancing is so critical. I'll take one more. You look like you have one.
Yes. Dr. Householder, has the health department consulted with the city on what training or resources to give code enforcement officers? Getting a lot of calls about businesses not closing. How are these code enforcement officers preparing themselves to go in these?
So a couple things. One, through the task force, we're working together, not just the city and the county, but all the municipalities, and also DeSoto has been involved, and Crittenden County have been involved. So we're trying to really have a united front and share resources and so on. The training that you're referencing is available for like the Blue Suede Brigade or people who would be doing that type of work. What people probably don't know is codes enforcement, as well as the inspectors in the health departments. We inspect restaurants, a lot of different facilities. We have historically worked together to address issues like this. And so we will continue to do that. Hobby Lobby is a good example. Codes had some portion that they could address, and there's things we could address as a health department. So we'll continue to work together and determine for each infraction, I'll use that word, who's best to intervene, whether it's codes, whether it's health, or whether it's just merely somebody going up and having a conversation and reminding people to do their part and stay apart. I'll take one more if there's any more.
Just really quickly, so am I correct in understanding that the health department closed Hobby Lobby here?
No, we did not close them.
Okay.
This was, if you've kept up with the CNN today, this actually became a problem in multiple states because Hobby Lobby had viewed themselves as essential, and they were determined not to be essential. So we had a team that had made contact, but Hobby Lobby made the decision to close in multiple states.
Okay, thank you.
Thank you all very much, and we'll be here tomorrow at 2, and we'll probably be here on Saturday. I know there's been a lot of feedback of trying to have something on the weekend, so ideally we'll be able to do that this weekend. Thank you, and thank you for interpreting for us.
Oops, I'm sorry.